You don't need to gaze into a crystal ball to discover what the future holds for our aging eyes. Visionary Dr. Michael Prokopius is here to help us look at what we might or might not be seeing as we get older. Dr. Prokopius is an ophthalmologist with Metro Health. So welcome to the show.
Thank you.
How often should seniors actually get eye exams?
We typically recommend a visit once a year, and we're not looking for anything particularly serious, but we want to make sure that we can detect problems before they do become more problematic for the patient.
Okay, so problems in the future, you've made a checkup checklist for us.
Correct.
So what's the first thing?
Well, the first thing is cataracts, and all of us develop cataracts to a certain extent as we age, and the cataract predominantly affects our central vision, our ability to do different activities of daily living. So it represents a clouding of the lens in the eye, and patients may mention things such as difficulty while driving or reading, just to name a couple examples. And the good news about cataracts is that it is a reversible cause of vision loss because we have surgery available to help with that.
That's a good thing.
Sure
so
enough.
Now I know that when I go for my eye exam, there's a pressure test that seems to happen I hate it, pop the puff of air in your eye. So what's that for?
The pressure test is part of a screening for glaucoma. And glaucoma is a disease of the optic nerve, which is the cord that essentially connects our eye to the brain. That cord has to function properly, otherwise we can lose our vision, unfortunately, on a permanent basis in this case. So one of the first effects of glaucoma is a loss of our peripheral vision, which unfortunately most of us can't detect that we're actually losing peripheral vision unless we do specialized testing to determine that. So the pressure test that we do and a careful look at the optic nerve is how we try to determine if a patient may be at risk for glaucoma. There is no cure for glaucoma, but there are treatments that are available to help control it, things such as eye drops, laser procedures, and surgery if need be.
Okay, well that's good.
Sure.
So what else are you eyeing in our eyes when you're checking things out?
Yes, another thing that we look for is the presence of macular degeneration. Macular degeneration, unlike glaucoma, can cause us to lose our central vision. And in this situation, though, again, similar to glaucoma, macular degeneration, there is no cure for it. And this actually is the #1 cause of new permanent blindness in patients over the age of 65. So it is a big deal, particularly for the senior population. There are a couple different forms of glaucoma, or of macular degeneration. There's a dry form and there's a wet form. In the dry form, there are oftentimes treatments, or there's a high-dose vitamin that can be used to help keep patients from going to the wet form. In the case of the wet form, there are injections actually that can be given inside the eye to try to help control it.
Okay. One last item on the list is the effects of diabetes.
Yes.
So what is that?
That's another very good point. In diabetes, there's a decrease of blood and oxygen to many different parts of the body, whether it be our kidneys, our eyes, the nerves in the hands and the feet. And when this decrease in blood supply occurs, it can again have a profound effect, in the case of the eye, on our ability to see. And in contrast to macular degeneration, diabetes is the #1 cause of new permanent blindness in patients aged 20 to 65. So it's a big deal also to be monitored for.
All right. Well, we got to watch out for the eyes, I guess.
Absolutely.
So when it comes to the health of your sight, you and your ophthalmologist need to see eye to eye. Look at your calendar and see to it that you set up an appointment and don't delay. My thanks to Dr. Prokopius for this eye-opening information.
To learn more, call Metro Health at 216-778-7800 or visit www.metrohealth.org. Next, getting into gear.